Hello, Clinic Review family. Today I'm getting back into the blue book and we're going to be talking about gonorrhea and genital herpes. Not real exciting, I know, but it's likely to be on your Nclex. It's fundamental information and it's not that hard to understand, so you can review it pretty quickly here. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. You know, this channel is part of the greater Clinic Review organization where we offer the very best Nclex review. And we also have small group tutoring. You pay for a month at a time. And we also have a streaming service. Today, we're doing the blue book. We're going to be doing gonorrhea and genital herpes. My finger is pointing to the blue book over my shoulder. You can purchase the blue book on Amazon if you're somewhere that it can be delivered to you. And if you don't have Amazon available to you, you can purchase the app, the Blue Book app at clinicreviews.com. Y'all, I don't make any money from this. Mark Klimek wrote it. It's fundamental information that you need to know. It does not have Nclex questions in it. It's just factual information. So people say, what do I need to know for the Nclex? It is the lists of factual information that you need to know in order to pass the Nclex. And I strongly recommend it. What I do is I write questions to go along with it so that we can practice it, study it using that way. So what we're going to do here is test the information that you've already studied in the blue book. So just to quickly give you just one thing, gonorrhea is bacterial, genital herpes is viral. And so that might be something that could help you remember the differences between them. So again, I'm going to say gonorrhea is bacterial, genital herpes is viral. That does change some of the presentation and it certainly changes the treatment. All right, so let's go ahead and get started. A 30-year-old female patient presents with painful vesicular lesions around her vulva that began a few days ago. Along with fever and malaise, the nurse suspects genital herpes, which finding is most consistent with primary genital herpes infection. Thick purulent discharge with no lesions, painless cankers on the vulva, clusters of painful vesicles, and systemic symptoms, warts that appear cauliflower-like. So I made this first question really easy for you because it tells you what the symptoms of genital herpes are. She has vesicular lesions and she has a fever and malaise. So vesicles and blisters are the same thing. If you have a blister on the back of your foot after wearing a new pair of shoes, you know that blister has clear fluid fill in the blister, and that's also known as a vesicle. So these are vesicles, which means they have clear fluid inside. That's more consistent with viral than bacterial. Bacteria tends to be purulent. So I don't like A because purulent discharge makes me think bacterial. Painless cankers. Cankers are not the same as vesicles. Cankers don't have fluid inside of them, and it's telling us she has vesicular lesions that are painful. So C is clusters of painful vesicles, which is what's described above, and systemic symptoms. The systemic symptoms are the fever and malaise. That's what systemic symptoms are. And so that is the correct answer. We're starting out easy. Okay. A 25-year-old male patient complains of burning with urination and purulent urethral discharge, which sexually transmitted infection should the nurse suspect first based on these symptoms: gonorrhea, syphilis, herpes virus, or chlamydia. So we're going to cross off herpes virus. Syphilis presents very differently. Gonorrhea it's bacterial and it does present with purulent discharge. Sometimes it'll say purulent, sometimes it'll say yellow-green. Purulent and yellow-green is sort of the same thing. So it's gonorrhea. A 22-year-old woman is being evaluated for possible gonorrhea infection. Which symptom is most characteristic of gonorrhea in women? Frothy yellow-green vaginal discharge with itching, painless genital ulcer, painful vesicular lesions on the labia, or thick purulent vaginal discharge and pelvic pain. So we can cross off B and C because there is pain associated with gonorrhea. We can cross off C because it's vesicular. Vesicular is herpes, genital herpes. So we see yellow-green and we see purulent. So we say, well, which one is it? Well, frothy is pretty specific. Frothy, I wouldn't pick frothy unless I knew it was frothy. That's like bubbling up, right? There's nothing about gonorrhea discharge that's bubbling up. It's not frothy, but it is purulent and it is painful. So the correct answer is D for gonorrhea. A 19-year-old female is diagnosed with gonorrhea. The nurse should educate her that untreated gonorrhea in women can lead to which serious complication? Ectopic pregnancy due to pelvic inflammatory disease, widespread rash on palms and soles, painless genital ulcer, infertility due to black testicles. Well, I hope everybody can cross off D. So we're going to cross that one off. And then we have gonorrhea. So we know it's bacterial. We know it's associated with purulent drainage. So there's some kind of an internal infection going on because she doesn't have ulcers or warts or anything like that externally. It's all about what's going on internally. And so we're going to get rid of C. It's certainly not painless. And rash on the palms and soles just doesn't sound like anything I've heard about associated with gonorrhea. So if we know it's internal, then you can sort of use common sense and clinical reasoning and say, well, if it's internal, certainly a bacterial infection can cause inflammation, and then it also can cause ectopic pregnancy. So that is actually and that is the major risk factor that we teach women with gonorrhea, that if you don't treat it, it can cause pelvic inflammatory disease. We don't always say ectopic pregnancy, although that certainly can happen. We teach them that pelvic inflammatory disease is the primary risk factor for untreated gonorrhea. A 27-year-old patient is diagnosed with a primary outbreak of genital herpes. Which medication would you expect to be prescribed? Azithromycin, acyclovir, metronidazole, or ceftriaxone. So we know that herpes is viral, and any medication that ends with VIR is to treat viral infections. So we know it has to be acyclovir. Ceftriaxone is actually used to treat gonorrhea. Metronidazole is used to treat trichomoniasis. I think that's how you say it, trichomoniasis. And so that is the correct, acyclovir is the correct medication to treat herpes. A pregnant woman at 28 weeks gestation tests positive for gonorrhea. Which of the following is the priority nursing action? Encourage the patient to wait until after delivery. For treatment, initiate IM ceftriaxone as prescribed. Inform her that gonorrhea has no implications for pregnancy. Suggest a cesarean section without further treatment. Well, she's 28 weeks, so we cannot do a C-section. She needs to be at least 37 weeks before we would say we could deliver her without it being preterm. So D is out. And C is certainly out. It certainly does have implications for the delivery of the baby. And we don't have to wait. We can actually do IM ceftriaxone. I know we don't usually do IM ceftriaxone, but it is recommended to ensure compliance. So instead of giving them pills to take home and hope they take them, then we can do an IM in the office and we can get it taken care of. And that's safe to give when she's pregnant. A 35-year-old woman with a known history of genital herpes is 38 weeks pregnant, so she's full term. She's worried about transmitting the virus to her newborn. The nurse explains that she will definitely require a C-section. A vaginal delivery is always safe if herpes is present. If no active lesions are present at labor, a vaginal delivery may be safe. Herpes does not affect pregnancy or newborn risk. So we're not going to say she has to have a C-section. That's not the correct answer, and it is a risk. So A and D are out. Is a vaginal delivery always safe? That's a pretty extreme statement to say, always. I tend to avoid extreme statements unless I'm positive that they're right. C, if no active lesions are present at labor, a vaginal delivery may be safe. So the key with herpes is this, genital herpes is the same as any disease that has lesions. Okay, lesions, if they're crusted over or if they're not present, even if they have the underlying virus, they're not transmittable. So the correct answer is if no active lesions are present at labor, the vaginal delivery may be safe. Now, it usually is safe. The reason we say it may be safe is because we're not the one that makes the decision. The doctor makes the decision if it's safe or not. So when we teach, we want to do correct teaching within our scope of practice. So we can teach that it may be safe. And even if we know, it's likely to happen, we could say it's likely to happen. We can say it may be safe, but don't say it always will happen because that's outside our scope of practice. A newborn has conjunctivitis shortly after birth, so pink eye. The mother tested positive for untreated gonorrhea at delivery. Which complication is the nurse most concerned about for this neonate? So she tested positive for untreated gonorrhea. The baby has conjunctive pink eye not long after birth. What are we concerned about? Ophthalmia neonatorum leading to blindness, neonatal herpes, congenital syphilis, or thrush. So if let's say we don't know, but we're just going to use common sense. This baby has an eye infection. Okay, so the possibility that it could lead to ophthalmia neonatorum leading to blindness, even if you say, I don't know what ophthalmia is, I know that means eyes, and blindness is an eye problem, and neonatorum is newborn, right? So that sounds reasonable. Like if I'm just purely guessing, A sounds reasonable. Herpes, well, they're not going to go from gonorrhea to herpes, so that's out. They're not going to go from gonorrhea to syphilis. And oral candidiasis, thrush, that's not gonorrhea. So the only one that makes sense, even if you don't know, is A, and it does teach you in the blue book that ophthalmia neonatorum is what we're concerned about when a baby is delivered to a mother with gonorrhea. A nurse is providing discharge teaching to a patient with gonorrhea, which statement by the nurse is most appropriate to help prevent transmission of gonorrhea. So we're talking about transmission, providing discharge teaching. Okay. Abstinence is not necessary once you start antibiotics. That doesn't seem reasonable to me. I would say I would want to see no longer having any discharge at the most. At the least, I would want to say 48 hours on the antibiotics. Usually people are not infectious after 48 hours on an antibiotic, but I'm just not comfortable saying A. Use latex condoms correctly for every sexual encounter. That's just a good Nclex answer. Good Nclex answer right there. Wash thoroughly after intercourse to prevent the spread. Maybe you only need protection during an active outbreak. Okay. If I'm just saying, what is the best Nclex answer? If I go, well, I've never studied on what to teach about someone who's got gonorrhea, but it says wear a condom every time. Like, I'm like, well, that's always a good Nclex answer. So pick the good Nclex answer if it's there and if it makes sense in the context, right? It's a great Nclex answer. So pick it. Use your common sense, y'all. Do not throw your common sense out the window when you're taking your Nclex. Sometimes it's just the answer that makes the most sense. If it seems like the right answer, y'all, it probably is the right answer. Which teaching point is most important for a patient experiencing recurrent genital herpes outbreaks? So it's viral, most important teaching. They're having recurrent genital herpes outbreaks. Okay, you can stop taking antiviral medication when you feel better. Well, that's not true if it's recurrent. Lesions are not contagious as long as they are small. That's not true. They can't have any active lesions. Take antibiotics to prevent secondary infection. That's not true. It's viral. Avoid sexual contact while lesions or prodromal symptoms are present. Prodromal means the precursor to the lesions, and that just makes the most sense. Y'all, use your common sense when you're taking these questions. There's just answers when doing this that just make the most sense, and make sure that you're using your common sense. Don't overthink. Okay, don't overthink. After delivery of a neonate to a mother with gonorrhea, which medication would the nurse expect to administer to the baby? Okay, gonorrhea is bacterial. I know it can cause blindness in the baby if left untreated. All right. Which medication would the nurse expect? Oral erythromycin. Well, I like the erythromycin, but I don't like the oral because they're a neonate. Vitamin K injection has nothing to do with it. Erythromycin ophthalmic ointment. I like that. Gentamicin eye drops. So if I'm purely guessing, it's going to be between C and D. And I don't know about you, but I definitely have seen them using ophthalmic ointment in newborns. I'm not a newborn nurse, y'all. I'm not a maternity nurse, but even I have seen them putting ointments in babies' eyes after delivery. And so if I'm just going to use my common sense, I'm going to go, well, I've never seen them giving eye drops to a newborn, but I have seen them using an ointment in the baby's eyes. And that makes the most sense to me. So that is the correct answer. You can memorize it if you want to, or you can just say, you know what? It makes the most sense. I've seen them doing that. A 22-year-old male is diagnosed with gonorrhea. Which complication should the nurse warn him about if the infection remains untreated? So gonorrhea is purulent drainage, both men and women. It's painful and it's bacterial. And for women, it can cause pelvic inflammatory disease. Okay, so it can cause pelvic inflammatory disease in women. So what can it cause in men if untreated? Epididymitis leading to infertility, pelvic inflammatory disease. I know that's out. That doesn't happen to men. Enlarged lymph nodes in the groin. Maybe, but that seems a little specific. Cervical cancer. Okay, that's out. All right. Epididymitis. I know it certainly can cause scarring, inflammation. leading to infertility. That just makes the most sense. So I'm going to go ahead and pick the one that makes the most sense. Not particularly complicated, y'all. I hope that was helpful to you, and I hope you do well on your NCLEX and any tests you're getting ready to take. So have a great rest of your day.